Now in this scenario, we're at a restaurant and there's a gentleman who was eating with his family or friends and suddenly starts to choke. This person was not able to get the foreign body airway obstruction clear while they were conscious, and they collapse onto the floor by the table. If this were to occur, we would walk over, make sure we have our personal protective equipment in place, explain to the family while we're starting to take action what we're about to do, and if 911 hasn't been initiated yet, or emergency medical services, that's when we're going to go ahead and activate EMS. Now we're on the side of the patient who's unresponsive and potentially choking. We begin with a head tilt chin lift. We open the airway. We look, listen, and feel for breathing, and from the conscious choking to the unconscious, nothing has seemingly changed. They're still not breathing. We look in the mouth. If we see an object, we're going to sweep it out and then attempt our 2 breaths. If we don't see an object, we're still going to attempt 2 breaths. And now we attempt our 2 breaths. We give a breath, no chest rise and fall. We reposition the head and give 2 more. No air goes in. It's at this time that we're going to go right to the chest, like in CPR compressions. Now, when doing chest compressions for the adult unconscious choking, we're still going between the breast on the center of the chest, 1.5 to 2 inches deep, 30 times before we reopen the airway and check for any obstruction that we can then sweep out. We come back to the head, we look in the mouth. If there's product, we pull it out. Even if there isn't any, we're still going to attempt 2 more breaths. The air does not go in. We reposition the head. Attempt 2 more. It still won't go in. We go right back to the chest and do 30 more chest compressions. Go back through the same thing until we get chest rise and fall, and we know the airway's open now. If the air goes into the chest, we're then going to check for a carotid pulse. If there is a pulse and they're not breathing, we continue with rescue breathing for 1 minute and then check for a pulse. If there's no breathing, no pulse, we go right into adult 1 rescuer CPR.